my gosh, what a great introduction. Thank you so much. I'm very appreciative of that introduction. I'm doing great. Thank you.
I'm glad you are. Let's just talk about hair restoration. I mean, I see a lot of bald guys, okay? I see the guys that are, let's just say, follically challenged that are walking around. And I think they've given up. They just shave the old head because of receding hairlines that have gone awry and whatnot. But before we get into why you are so great and why you don't have to go halfway around the world to get your hair back, just how difficult a process is hair restoration? Is it involved? I'm sure it's not one stop and you're cured, but how involved is the process?
Well, it's a great question you're asking, and the answer is it can be extremely involved or it can not be, because many patients have different stages of hair loss. So depending upon the stage of hair loss you have determines how much of a challenge it may be to restore it. But step one always in the process is trying to get the patient on some form of preventative treatment. We fortunately have 2 FDA-approved preventative treatments that exist. The first one being Propecia, which is the brand name. The ingredient is finasteride, and that's a pill, and you take one pill, and that helps to stop the genetic reason we're losing our hair. So that stops the testosterone from converting into the dihydrotestosterone. That's what's causing a mucousy secretion called sebum to build up. That sebum buildup will then miniaturize the hair follicle and keep it from making its way through. So that Propecia is directly stopping that conversion, and that helps to keep what we have in place. The second FDA-approved treatment is called Rogaine, which I know you know about, been out since the 70s. That's another great product. However, that's applied twice a day topically. It's a vasodilator, so it opens up the blood vessels. It allows more minerals and nutrients and oxygen to get where it needs to go to make a better environment for those miniaturized hairs to make their way through. So if you have extensive hair loss, we always recommend more than one procedure because it's a large surface area. Whereas if you might have a smaller area that just needs to be filled in, you might get away with one, depending upon the stage you're at and whether or not you're on these preventative treatments.
But if you're completely bald, you've got to do the plugs, right? Taking finasteride is great. A lot of men take finasteride because of an enlarged prostate.
Exactly.
Or Rogaine. It's great if you're just thinning, but if you're somebody that it's all gone, you got to get into the plugs at that point, don't you?
You're exactly right. But even though you're lost most of your hair, we still need to secure what's left. Because so for example, let's say I restore the top of your head, and then on the sides it drops down. So then you create this like alley around the transplanted area. So you're chasing the loss. So whether you're bald or not, it's always recommended you do the treatments so we don't have a moving target, because it just makes it easier to get you to the finish line. Those products do not grow hair. That's one of the biggest misconceptions. People think, I'll get my hair back. No, you don't. You're just using those to help protect whatever you can, and you still can lose more hair. So in the case you're talking about, a guy who has a lot of hair loss, typically, what I do is unique. I happen to move more hair than anybody in the world. My patients flying from all over the world to have me do what I do because it's a unique procedure. And, I usually, like my patient today just got finished. He was pretty much bald, like you said. We took him from front to back. But he's going to need to come back. I have to space it out a little bit more. So depending upon what their expectations are determines how many times they want to go through it. This one guy might come out and say, hey, this is great, I love it. The next guy might come back and say, oh, I need another. So it's, beauty's in the eye of the beholder.
So you would do the plugs and then maybe do like finasteride or something like that as a maintenance thing? Is that what you would do?
Exactly right. Yeah. So, and I love how you keep saying plugs. That's awesome. What's funny is the FUE surgery that they're doing now that Turkey does is essentially the plugs are invented. So for us older folks, remember the baby hair, the baby doll hair look where they had the little plugs all over the place. So what they're doing with the FUE is they're using the same punch biopsy that they did with the plugs. However, they're just now using a smaller punch biopsy. So they took the oldest piece of garbage procedure, reinvented it with a new name, and they're selling it to the public as the latest and greatest technique.
Well, I'm reading this story here, and it said that the hair restoration and transplant business is massive. I mean, in 2022, the total number of hair restoration procedures worldwide was 735,000, and that the hair transplant market size stood at U.S. dollars at almost $6 billion. So I'm sure it's greater than that because those numbers are at least 3, maybe 4 years old. Well, you mentioned Turkey. Okay, so I envision all these bald guys getting on an airplane and flying to Turkey to get this done. From what I hear,
they're doing it.
Yeah,
they're doing it.
But the Turkey, is it cheaper in Turkey? And if it is cheaper, are you getting the same thing you'd get in the United States?
So again, it's going to be a mixed bag. So the reason why people are going there is they're offering procedures at a fraction of the cost of what we're doing here, but they're doing the FUE procedure, what we were just talking about. Yeah. And the reason they're doing that is the doctor doesn't have to be involved as much in the case. Oh. So, for example, I could offer FUE in my clinic, put it in the back room, have technicians do it, and not be involved, and probably triple my revenue. Mm-hmm. I don't do that because I don't believe that's the best way to do it. I would do it if I felt it was the best way to do a procedure. I'd be doing FUE. So, you don't, like, even in the United States, the doctors that are doing FUE aren't doing it. They have clinicians or technicians fly in, they do the procedure for them, and they're in their other room doing a nose job or a boob job or dermatology or whatever they're doing. Oh. So that helps to explode the industry because you don't have to have that doctor be hands-on. Yeah. And it's not even legal in any of the states what they're doing.
So you could go like to Turkey and get hair restoration, get a boob job, maybe a Brazilian butt lift, and be out the door like in 8 hours, right?
Well, maybe.
No, I don't. Yeah, but what are you paying for? That's the whole thing. Is what are you paying for?
It's a mixed bag. So you can get them for a few $1,000s down there, but they're not doing, in my opinion, quality work. I do a lot of corrective surgery on those patients.
Yeah,
the hairlines are very unnatural. The grafts are always in the wrong angles, which is very important. How they're angled up, and they'll just be angled funny where they don't lie nicely. Also, the way they harvest the donor hair, they're taking out of what's called the safe zone. So you know how you picture that bald guy who's got that ring around the back?
Yeah.
So they're taking outside of that ring when the patient has hair, but when the patient loses the hair later on, they're going to lose their transplant. So because you got to be specific where you get the hair from. Right. So there's a lot of pitfalls. And who's working on you in Turkey? Who's there? Who's in that room? You have no idea.
No.
I mean, with me, my same staff, 10 years, that's all we do every day. Doing the same thing every day with my staff. And I've been doing this 28 years. So, you got to understand you get what you pay for.
No, absolutely.
And
you created this Max Harvest, which is trademarked under your name. That's the technique you use. And I said you were I guess it was the world's greatest television show. You were named the greatest hair transplant surgery in the entire world. I mean, that's pretty big stuff there, Doc. Pretty big stuff.
Thank you so much. That's very humbling. I'm very humbled by that. Well, I really appreciate it.
Why are younger people driving this demand for hair restoration? Are people? Have you noticed that hair, that baldness, or whatever the medical term is for it? Do you know that is happening? Do you notice that is happening more and more with younger people than it might have been in years past?
I think the biggest driving factor is social media. You have a lot of these influencers that are going out and they're going to Turkey and they're filming the whole thing and they have their followings. And then you have a lot of these all sorts of like social media pages where they communicate about the transplant and they have 10 million commercials for hymns and Roman and blah, blah, blah. So I think with all that marketing, it's really put an emphasis for younger people to get the restoration, whereas before you never saw that. That was never out there.
Yeah.
So I think all of those factor into this. And then it's available everywhere now that all these doctors, like, there's a dentist locally that does FUE. We have the guy down the block who, anyone can put a machine in their back room and have a technician do it. So that's really changed everything. Yeah. And that's made it where it's a lot more available. Where when I first started, my patients, everyone flew in because there was just not that many quality doctors doing the transplants. But now they can go locally because there's more people doing it.
Dr. Brett Bolton is our guest. Again, he is regarded as the greatest hair transplant surgeon in the world, and we're talking about how you not only can get a nice full head of hair, but also you can maintain it so that you don't have to worry every 6-8 months whether or not it's all going to fall out in the shower. Do you have to take hair, doctor, from the head? I mean, some guys are just hairy. They got it on their chest, they got it on their back, they got it on their arms. Do you have to take it from the head, or can you take it from other places on the body?
So you're 100% right. Yes, you can definitely take hair from other parts. Follicles can be moved from your arm or your back or anywhere there's a blood supply, it can grow. So yes, we can definitely do that. But those are for like super extreme cases. Yeah. We want to, obviously get as much out of the donor area as possible. Sure. Because remember, your arm hair is going to grow like an arm hair when it gets on the top of your head. Right. Your back hair is going to look like a back hair. You know what I mean?
Right. No. Yeah.
So we want to definitely use the proper donor hair if possible, but there's definitely some extreme cases where patients are really gone and we need to take it from other areas for sure.
I tried to nail you down on a price if I go to see Dr. Brett Bolton, and you said, well, it depends on the severity. So obviously people that have a little more hair to work with, it's not going to be quite expensive, but there's got to be like an entry-level price, right? There's got to be like that car without air conditioning and a radio. So what is it in your business? What's the entry-level price?
So for me, my prices start at $6,000. So, but then they can go upwards to $28,000. So depending on how much, well, you have to understand when you pick a doctor that's been doing this 28 years, you with guaranteed results, you're getting what you're paying for.
Yeah, I would.
So when you go to, last thing you want to do.
Yeah, I mean, you look, you hung the shingle 28 years ago, and if it didn't work, you'd be in some other line of work at this point. So yeah, it must work. And how backed up are you? Like if somebody's listening right now and they want to say, "Hey, I want to go to Fort Lauderdale. I'm going to see this guy." Are you taking patients into 2026, or are you booked up to like 2035?
I wish, but no, we definitely will make room for anybody who's ready for a hair transplant, especially if they come from your show. So we'll make a special opening for your audience.
Well, that's Dr. Bolton there. He'll guarantee a full head of hair and a full set of teeth. And
that's awesome.
But the fact of the matter is, it is a booming business because people want to. Doc, people just want to look younger. They want to look better, and they want to look younger. And whether it's a facelift or some other part of your body that needs a lift or hair restoration, we're in a society right now that does not treat older people as well as they treat younger, good-looking people. Have you noticed that?
I completely agree. Yeah, I have patients like, it was funny, I told a story about a month ago. My Monday patient was an 84-year-old man, and my Tuesday patient was an 85-year-old woman. And this is in Florida, and they both said that. I asked them, what's your goals? Why do you want to do this? They both had the same answer. I look in the mirror and I don't see myself anymore, and I want to feel like myself again. And when they get that hair back, it gives them the confidence back. It changes the way they see themselves. Even though they're elderly, they don't want to look that way or feel that way. Right. So it's a great time for cosmetics because we have all sorts of different treatments, that little touches that are not too hard to do as far as the injections, the Botox, the Restylane, and the big deal for the men is the hair. So it's a really great thing, and it really, as corny as it sounds, it changes people's lives.
Yeah. I look in the mirror and I say, who the hell are you and how did you get into my house? That's what I do. Doc, how do people get a hold of you? Where can they find Dr. Brett?
Thank you so much. At greathairtransplants.com.
Okay. Great hair transplants. Gotcha. Greathairtransplants.com. You got it. All right, Doc, this is good stuff. I'm enlightened.
Thank you so much.
Hopefully someone else is. You take care, stay well, and if we don't talk again, have a happy 2026.
Thank you so much for all the kind words, and thank you for having me on your show.